Dentists who are thinking about working with us ask me all the time, how long does it really take to get a dental practice rolling? I want to tell you the answer when we return. Hi, and welcome to another Saturday edition of the Patient Attraction Podcast. I'm Colin Receveur, founder and CEO of SmartBox Web Marketing. And I don't use very many of these podcasts to talk about my company. Instead, I like to focus on educating dentists about what effective web marketing really looks like. But today, the two kind of intersect, and I want to talk about the question, how long does it take to succeed? First off, let me put forth the factors that go into the equation of success. There's, many things: work ethic, adoption rates, clinical competency, people skills, accurate thinking, time management, your self-confidence presenting treatment. I mean, let's be honest. Sales and marketing does not just entail getting people to call your office. Your level of authenticity, the ability of you to focus and drive the practice, your level of ambition. You may be very content doing $1 million a year and never want to go higher. I can go on forever, but the short answer of this equation is when the why meets the how. And if the reason for what you do and the processes that you do created makes sense based on, your worst case real world scenarios and are implemented in an efficient and clear way, it's reasonable to assume that you should see a significant shift in the 90 to 120 day range in full momentum in about a year. But coasting never happens. If you're not growing, you're shrinking. And my guess is you've probably found that out in your own practice. You were doing some good numbers for several years. You kind of thought things were on autopilot. You stepped back and you kind of let things coast, and now things have fallen. They're not where they once used to be. You are forever working on your practice. It takes constant attention and intention to drive things and keep them where you want them to be. It's kind of like a child. Your practice is going to change and evolve over the years. And that's why I'm not a big fan of long-term goal setting. Focus on the short term. Get something done each and every day. The future is far less predictable than the present moment. Now, that doesn't mean you shouldn't have what we call your BHAG, your big, hairy, audacious goal for down the road, but focus on the present and the medium term. Question your whys and test your hows, and never see things as successes and failures, only results. Every time you fail, you find out one way that it didn't work to succeed. In addition, focus on what you're good at. Delegate and outsource what you don't enjoy and what you're not good at. The reality of marketing is you're never going to do what it takes to implement on your own. And as entertaining as these podcasts may be, participating in them, watching me at 7 a.m. every morning isn't going to drive your practice. It may be educating you, but it's not bringing new patients in the door. Now, the good news of all this is that we can do all your marketing for you 100 times better, and I would guess 10 times cheaper than you can do on your own. To get started, to see what a patient attraction blueprint for your practice would look like, visit patientattractionblueprint.com. Your practice will never be the same again. Until tomorrow, keep moving forward.